Hi guys, this is Lami again. I'm TraXel's nurse coach. I'm here with another episode of Holistic Approach to Wellness with MS. I'm super excited to have my guest here today, Dr. Rivas. I'll introduce her in just a second. I did want to just say again, for those of you who are not familiar with me, I've been a nurse for almost 30 years. Been a recently wellness and health coach for the last 3 years, and I also was diagnosed with MS in 2020, so I've been on my own personal healing journey with that. Getting more into holistic health, which is a huge part of why I became a coach. I just want to say too, thank you for your patience. I know this is the first episode of the year. And also just want to remind people that this has already been going on for 2 years. You've been with me for 2 years already, so I really appreciate that, and I hope everybody's year is starting off well. Okay, with that, so I've got Dr. Erica Rivas here with me today. She is the medical director of MSNIA. It stands for Multiple Sclerosis and Neurological Institute of Austin, and you are the medical director. Hi, Dr. Rivas. Thank you so much for joining me.
Hi, Lami. Thank you so much for the invitation and the opportunity to talk to people in Austin and across the world. So I'm really excited to be here.
Yeah, and I'm not sure if I even told you how I found you. Did I tell you that story? I had heard you on another podcast there's another podcast called Better Medicine for anybody who's interested in other, opportunities to learn. It's called Better Medicine, and it's with Dr. Omar Akhtar. And so I found him because he's not too far from me. So when I just Googled doctors that are doing integrative functional medicine. Anyway, found out he had a podcast, and then you were on it, and I said, because I was already interested in his information already, and then he had you specifically talking about MS and holistic treatments. I was like, oh, I definitely have to find out more information. So anyway, I don't know if I told you that, but that's how I found you.
Oh, yeah. Well, I'm glad that we connected.
Yes, definitely. I love that. And so basically, too, just to start, I just want to talk about, of course, so this podcast is about holistic health. We talk about the importance of, the whole picture and not just necessarily treating with only medications. Not that medications are very important, of course, but looking at the whole picture of, what can we do in addition to that to help ourselves. And so with that, I do just want to start with, how do you specifically approach MS in your practice, and then even more so specifically with the mind, body, soul connection.
Yeah, absolutely. So, and just to get started a little bit about MS or multiple sclerosis, and what is this, right? Is an inflammatory autoimmune condition that causes demyelination. So that is loss of the myelin, which is the insulation of the nerves that are involved in your central nervous system. So that's brain and spinal cord. And people can have a different range of symptoms that can range from having sensory issues or motor or visual disturbances, coordination problems, fatigue, cognition, etc. So being a disorder of the central nervous system and the spinal cord, so I often explain to my patient, this is the computer, right? So it controls all of our systems and bodily functions, right? So we're talking about, if you ask a neurologist, right, the most important organ in the body, and we really need to protect this organ because once we get injury, right, it's hard to recover. Now, our body has some mechanisms of repair and healing, but it's not going to be 100%, right? We're not going to heal necessarily 100%. So it's important to keep that in mind and know that we often say time is brain, right? So the sooner we can recognize these symptoms and get help and get a diagnosis, the more of the brain and the spinal cord, right, or the central nervous system we can can protect. And with that, I want to talk about what is a neurological reserve, right? Or what's the neurological reserve capacity, which is the brain's ability to effectively buffer the changes that are associated, one, with aging, right? How do we cope with the damage that comes already with aging? And then, right, so that's a reserve, and everybody is born with such reserve, and we're all different. And then now if we add MS to the picture, that can complicate things a little bit, right? Because the reserve can be depleted by factors like MS, for example, but also the natural phenomenon of aging, right? And then we also have to think about other medical comorbidities, right, that people can develop as they get older, like hypertension or diabetes, right? And this is important because at least some of these conditions can be preventable or treatable, including MS can be treated. So we want to make sure that these are all controlled in order to protect our neuronal reserve and have a better or quality of life, right, or lifelong, right, health.
Yes, that's a very good point, because I never really have even addressed that at all. As far as, yes, MS is already a bad enough condition, but then yes, you add other health conditions, like you said, high blood pressure, diabetes, other things. And, if you already have that, I'm not saying, obviously you can't do anything about that, but you can at least do what you can to somewhat control that, again, with diet, exercise, etc. So that's a good point. And then to also keep that in control can also help with MS.
Yeah. And to go back, right, to think, how do I guess, going back to your question, or, the way that I approach people with MS when they come in, right? So it's okay, we identify what we're dealing with. So yes, this is MS, right? We have to trust but verify, and I look at my own image, the images, the MRIs, and make sure that we're ruling out other mimickers for MS, and then we want to make sure that we are treating the individual. Right? Because everybody's different, right, with MS, and they all have different presentation, etc. So we want to understand their MS, their perspective. We want to work together in their treatment, creating their care of treatment. And to me, that includes a medication that we know can stop the inflammation in MS, and that can help reduce or slow down or even stop the injury to the central nervous system. And in addition to that is, how do we focus on the general health and well-being, which is also very important. And on top of that, right, the aging process that we talked about.
Yes. So speaking of that, is there any research on aging, specifically maybe even with women and hormone changes or anything like that?
Yeah. So so aging, right? So we're dealing with the brain that starts to age. Our neuronal reserve, like I was talking earlier, can come down, and we want to protect our brain from things that are more common as we get older. And then there's some hormonal, like you mentioned, so hormonal changes between men and women, and where estrogen and progesterone can be protective and can be anti-inflammatory. So once women reach perimenopause or menopause, that loss of estrogen particularly could potentially make people more prone to some inflammation. But it's also true that with aging, the immune system goes quiescent or slows down. So we often tend to see, less MS activity or relapses or inflammation. Sometimes, but we have to keep that in mind that even though MS can be more common in women or more common in younger women, still women presenting at an older age, right, because of that loss of estrogen, we still have to think about MS, right, potentially causing an inflammation or flare.
Yeah. Okay, that's interesting. Yes, and then also kind of going back to what we were saying earlier about your approach to MS. Like, I do appreciate that you take time to really listen to the patients, and then like you said, that's everybody's different, and that is one of the very complicated things, right, about MS, I'm sure on your end, especially just not having a textbook kind of definition of symptoms, and then how everything is just so different like that. But and then also too, I've often talked about neuroplasticity, and can you kind of, if you have any opinions on that, talk about that, or brain health in general?
Yeah. So neuroplasticity, we cannot measure that, but we know that the brain is able to adapt, to change, to internal and external factors, right? And these are, people go through life experiences, learning, environment, physical injury, and this is the ability of the brain to adapt and evolve, right, with the human body, and then be able to hopefully be resilient with everything that can happen. And in MS, right, particularly, right, we want to slow down the brain aging and then maintain that neuroplasticity. So one of the things that I recommend is vital for people with MS is this, to stay cognitively active as much as possible. So this is going to help with maintaining the best. The best kind of medium, right, for our brain to adapt and then to help with the aging process. For MS patient, for example, I know it can be hard with our day-to-day, we're busy, but even we're dealing with fatigue, and if we can take a short nap, this can help with cognitive performance in the workplace, for example, and also helps with regulating our emotions, which can also be another common symptom in people with MS, and in addition to helping with their physical well-being as well, like helping them with mobility, for example. And this is all part of healthy well-being, healthy lifestyle, good habits, and in maintaining independence.
Yeah, I love that you mentioned that, because that's something I haven't really touched on too much, is the importance of brain health. And like, I love that you said just keeping just our cognitive abilities in general and active, like you said, because talk about like the physical part of exercise and movement, which of course is important, but of course keeping our brain active also. You're right, that's a good point. And then also too, I've always just talked about the importance of like I said, diet, exercise, getting plenty of rest, things like that in general, as far as what we can do in our control to help with things. I've always talked about being advocates for ourselves and making sure that we really are just learning as much as we can, and knowing our options and doing a lot of research, again, to advocate for ourselves and all of that. Did you have any other things to add in terms of, like, in general, what can be done like that? Or
Yeah. And let's talk about diet. You mentioned that, and I know that's a very um, is a common question that we get, and we don't really have a straight answer for that. We're learning that fruits, vegetables, Mediterranean diet, are good for prevention of Alzheimer's, dementia. It also, there's some studies showing that eating more fruits and vegetables can help lower the chances of getting depression or anxiety versus eating the typical Western diet of things that are uh,
Just processed.
very processed, or ultra processed, refined, right? That is not healthy, right? So we want to promote something similar, although we don't, have conclusive evidence. It's always hard to measure these studies in diet in MS, but overall, I tell people common sense. So you eat a banana or eat a banana muffin, right? You probably want to eat the banana, so whole foods, legumes, low fat, and then there's even some potential benefit with intermittent fasting. But again, this all has to be taken, very cautiously, right, and not follow any extreme diets, right, because we don't really, know for sure, right, in terms of the diet, but more common sense with that.
I love that. Yeah. Were you going to say something else?
I was just going to mention the exercise part, since you also asked about that. But I don't know if you had another question specific to diet or nutrition.
No, I was just going to kind of reiterate what you said. Personally, I believe too, just everything in moderation and nothing too extreme, and also what works for you. And I've talked about it with our last episode, but the importance of symptom tracking, right? So we can see, okay, when I eat this certain way, or I'm doing this certain thing, or I'm sleeping this, like helping with symptom tracking to help determine that too. But that's a good point.
And also diet, right, is important in regulating or preventing other comorbidities, right? So if you have a low fat, low cholesterol diet, that's also good for the heart, prevent cardiovascular disease and lower your chance of getting a stroke, which, is another type of brain injury. So imagine having MS and then getting a stroke, right? That is devastating. So we want to do everything possible to prevent further brain injury, right? From hypertension, from diabetes, from thyroid disorder, from strokes, right? So diet can help with some of these other potential comorbidities, right? That we want to prevent.
Yes, and you're right. I think it can get confusing as far as like, what should we do? There's so much information out there on that, but yes, just breaking it down to just common sense, I feel like it's pretty simple. And either way, like I get what you're saying. We don't know the actual like specific, one diet fits all kind of thing, but like in terms of just in general, if we just eat just whole foods, cook more at home, instead of eating out, like all these basic things that you're talking about, it's helpful regardless, I feel like, whether you have MS or not, helps with the other comorbidities. It just helps in general just to eat healthier as much as you can.
Yeah, absolutely.
Mm-hmm. Yeah. And then did you have any just key takeaways or anything, or advice that you can give just for MS patients in general, for symptoms or just anything?
Yeah, I do. But before that, I wanted to mention the exercise, right? Exercise, yeah. So, and everybody can do some level of exercise, right? Even with mobility, right? There's some people with MS that may have some limited mobility, or some people that may have other disabilities. But exercises can be tailored to the level of physical activity that you're able to do based on your MS symptoms. But in those that can, we recommend at least 30 minutes of moderate exercise 2 to 3 times a 2 to 3 days per week. And that could be your weight training or cardiovascular, and also focus on flexibility, balance, and that's where yoga, for example, can be very helpful for maintaining the flexibility, and meditation to help with that part as well of well-being. And then for those people that may have a little bit more mobility limitation, maybe 10 to 30 minutes, if they can, moderate aerobic exercise, also 2 to 3 days per week. We can do something called high intensity interval training, like once per week, for example, and then still focus on flexibility and balance. And then for those individuals that are, perhaps more limited in their mobility, where they're having to rely more on the use of a wheelchair, for example. 20 minutes, 2 to 3 days a week, or if they can, daily, but shorter period of time. Focus on breathing, right? Because if we're not moving as much, then we might not be taking deep breaths, and then that could cause other problems. So we want to focus on breathing, and just do what you can do. Work at your own pace. It's kind of like a good rule there. And then you mentioned takeaway points for MS patients, and I think I can start with maybe the doctors, right? So we want to make sure that we're reaching out to general practitioners and to other professionals, right? To emergency room doctors, right? To help us, right? Capture people that present with neurological conditions, to just think about MS, because the sooner we start with treatment, right, the sooner we diagnose, the sooner we can start treatment, and that is going to promote preservation of our central nervous system with medications for MS, and all these approaches that we would recommend. So that includes eating healthy, the exercising, emotional well-being, right? So part of that is we can do meditation, yoga, but we're social beings, and we want to be connecting with other individuals, right? And that could be family, friends. Support groups are so important in that emotional well-being, and sometimes we need counseling, right, or some other therapies like cognitive behavioral therapies. Other things to help with our lifestyle and preserve cognition, age gracefully, right, with MS, right. Besides, we talk about the exercise. The mind, right, with the yoga, but cognitively active, reading, learning new things, being creative, socializing, that's also so important. Having a good sleep, and then with sleep, sometimes we don't realize that we might have other symptoms that interrupt our sleep, like can be bladder issues, and when we're talking about people with MS, and if we're having to wake up frequently, we were not getting good sleep, which can enhance our MS symptoms, and it can aggravate our mood, our cognition, our fatigue. So it's important to get also good sleep. And for example, if it's because of your bladder issues, so there's things that can irritate bladder, like caffeine or alcohol. Sometimes we need medications to treat that. Sometimes we can treat it with physical therapy. And then, getting a good sleep will help with control pain, control stiffness that we can see in some people with MS, the cognition. So I think it's important to also, try to have a good sleep. And there's some other things that I could recommend for sleep, and kind of like your day routine, right? When do you then exercise? Is it better in the morning, the evening? So we think maybe in the morning is better to exercise. It helps with your energy level. In the morning time, it helps with regulating your body temperature, which sometimes is hard for MS patients. And then exercising early will will allow you to have a better night rest, right? If you're coming back to that sleep portion. Yeah, so I think overall, it's good to find a neurologist that knows about MS, right? That's going to be the number one thing. I would say when we're talking about the care for MS, and then somebody that you can resonate with, right, in your care, perhaps somebody that works together with you in coming with a plan of care and what things that you want to work on together. I think that's the best, kind of approach in how I work with my patients, right? That I'm not telling you what to do, right? We're like, hey, okay, let's talk about this. Tell me what you think. Okay, this is what I know. This is what I'm thinking. And like, what do you think, right? So we kind of work together, to come out again with a plan and the best treatment for you, like individualized.
Yeah, I think that's how it should be. I'm so glad you said that, because it should be a discussion. It shouldn't just be like, okay, you do X, Y, Z. It should be, well, how do I live my life, and how can I incorporate everything you just talked about, or how can we, like you said, it's just helpful to be listened to and heard, and have time talking to your patients to actually have a discussion on what's best for me versus other patients, kind of thing. So I loved also that you touched on emotional well-being. I think that's huge, especially with the connection and community. I always talk about that. Everybody should really just lean into resources and community as much as possible. I mean, even if like you're not necessarily in-person type thing, so there are like meetup groups that you could find in your community. Even if that's not your thing, there's always things on Facebook, communities that you can, have connection with, and that helps just to feel like you belong, to feel understood by others who are going through the same thing. So I think that's huge. I love that you talked about that. But well, I wish I could talk to you way longer, but I appreciate your time and just talking with me in general. And I was just going to say real quick to my TraXel community, if you have any questions or any comments, please reach out to the forum and subscribe, of course, to this channel. But any questions or comments, please don't hesitate to do that, or on also just the YouTube channel in general. I'm also on Instagram as Nourished Soul Coach, so you can reach out to me, message me, or just follow me if you'd like. That's Nourished with the ED, Nourished Soul Coach. So again, thank you, Dr. Rivas, for joining me, and I hope everybody continues to just keep each other healthy, happy, and everybody have a great week. Thank you.
Thank you so much, Lami, and thank you, everybody. Thanks for listening.